Welcome back, America, to Malin Medical Magniloquence, Episode 3, COVID-19, Gloves Off. But first, a quick message from our sponsor. I have had it, and so has most of America. This is ridiculous how we are acting, and it has to stop. We are letting politicians and the media destroy our country. Home of the free and the brave? My ass. Not so free anymore. Can't go out in public without masks. Can't go grocery shopping. We're being mandated to shut our businesses down. We're being mandated to close our churches and not be able to sing in churches. Our farmers are being mandated by the government to plow their fields and kill their cattle and slaughter their extra poultry. People of America, this has got to stop. Home of the brave? Americans used to be brave. We forged through vast frontiers to create this great nation. We've stood up against Nazi and communistic regimes in the name of freedom. But now we're acting like a bunch of chickens hiding from an upper respiratory virus. We've self-quarantined, we've shut down our lives, shut down our businesses because of an upper respiratory virus. President Trump, at the beginning of all this COVID stuff, you may have made a mistake and you called it a hoax, and then the Democrats tore you up about it. They said, oh my gosh, President Trump's being irresponsible and he doesn't care about your health and your lives. Well, if you had used the word scam, now we might have believed that, because that's what's happening. We are all being scammed out of our civil liberties, our constitutional rights, our jobs, and our ways of life. There are entities out there that are systematically working to try to destroy our nation. The left-wing radical, not just in the Democratic Party anymore, the anarchist groups, the Marxist groups, all trying to destroy the American way of life. We are creating a nation of antisocial, paranoid, germphobe hypochondriacs. And look, our job in the medical field is tough enough. We don't need this. Okay, so let's talk a little about these masks that we're being mandated to wear. Some of them are pretty cool, and they seem to become more of an accessory item than actually a protective item. In fact, one of my patients actually made this one for me. But here's the reality of these masks. These masks are causing more harm than good, and we should not be mandated to wear them. So the CDC has come out with a statement saying that these masks should be worn by people who are actively ill with upper respiratory symptoms and the people who are sick and elderly and at risk. They even said that the general public, the wearing of these masks is not going to help prevent the spread of COVID-19. It is completely unnecessary. These masks are causing harm. I've seen several patients that have had facial rashes, dermatitis. I've had to drain abscesses from the neck and ears of people from wearing these masks. I have had to treat 3 adults with thrush, which is a yeast infection in the mouth. These masks, when we constantly breathe out, we're creating moist bacterial and fungal pathogen cultures in them. And then we're constantly breathing them back in and out. So we're seeing more sinus infections, throat infections, respiratory infections. People with asthma are having worsening asthma exacerbations. People with lung disease are wearing these masks and their oxygen's going down, their carbon dioxide's going up, their blood pH is going down, and it's putting them at more risk. I had a little old lady just the other day in my office. She had her mask on. Her oxygen was at 88% when we checked it. We asked her to remove the mask for 2 minutes. Her oxygen went up to 95%. These masks are also a hazard to people with mental conditions. Try asking somebody with severe anxiety, claustrophobia, PTSD to put one of these masks on and wear them at all times. They just can't do it. So there's millions of people out there who have medical conditions that really inhibit them from being able to wear them, and they really shouldn't be wearing them. There's millions of you out there who have already had COVID-19 and are immune to it. There's a lot of people that were not reported. Millions of people had a bad cold, didn't go into the doctor, didn't go to the hospital, didn't go to a COVID testing station, and you had COVID-19 and now you're immune, but you now have to wear a mask? So shame on all you corporate entities, Walmart, Costco. Now I'm seeing it more in Circle K, Fry's, where they're saying masks required. So you're requiring us to do something that is probably causing more harm than good. And it's been proven that these masks really do not work to help stop COVID virus from entering your system. Now, the only masks that really do a good job of that is the N95s, but those are too expensive and many people can't wear them. So we're being mandated to wear masks that don't work and are causing harm. I'm sorry, I took a Hippocratic oath and I take that oath seriously. I refuse to participate in that madness. So where do we stand here? The CDC has come out and said that masks really shouldn't be required. Dr. Fauci himself said that these masks probably shouldn't be required, but the corporate entities are still doing it. So this corporate mentality of, okay, if one does it, we all do it, is dangerous. So if one person causes harm to themselves, we're all supposed to cause harm to themselves? No. So the CDC has come out and they have said that, and their story has changed several times, that these masks should not be required for healthy people to wear them. And they have also said that these masks really do not help stop the spread of COVID-19, only in patients who are actively ill. So why are we still being mandated to wear them? Well, to keep the fear and panic going as a means of control. So who is the CDC? Well, the CDC is a vital organization that helps stop the spread of disease and for disease reporting and tracking. One of my patients jokingly said the CDC was the Center for Democratic Corruption. I think they are a vital organization and a part of our medical care delivery. However, sometimes they do come out with guideline recommendations that are based on computer analogs and computer scenarios of how something might play out, and they might tend to overreact. Back in 2016, they came out with guideline recommendations about the overuse of narcotics and made recommendations for a 90 milligram morphine equivalent. Well, this did cause a lot of harm to many patients because our governors, our legislators, and everybody took it upon themselves to make it law and form the Opioid Epidemic Act. But I'll talk about that a little later in my subsequent episode, Malin Medical Magniloquence, the creation of narcotic Nazis. So why is the CDC now reporting that numbers are going up and we're having to close businesses down again and people are panicking again? The main reason is because of false reporting. The CDC can only work on numbers that they get in. And some of the numbers that they're getting in are being skewed by false reporting. Some of the rapid tests that are being used have a sensitivity and specificity rate of only around 70%, which means there's going to be a lot of false positives and false negatives. But yet when it's positive, those results are being reported. Even in patients who aren't actively ill and they come out with a positive report, is still being reported. People who are getting their blood drawn and having IgG antibodies that are positive, well, that just means that they were exposed to coronavirus at some point in their life, probably within the past 5 years, but that doesn't mean they were exposed to COVID-19. And the CDC even came out and retracted some of their statements about that, saying that we cannot use IgG antibodies to say that somebody had COVID-19. The sad truth about this COVID-19 situation is that more people are dying and are going to continue to die because of the mandates and business closures and everything that has been imposed by our governing officials, and the fear and panic that has been perpetuated by the media. The amount of stress, psychological stress, the suicide rates are up 41%. People are dying. Thousands of people have died because of delayed health care because they're too afraid to go into the hospital. They're staying at home and dying. And the lack of medical care, because doctors' offices have been closed because of the fear and panic. So the access to medicine and the lack of medical care is killing people. The amount of stress and everything from this situation, the crime rates are up, and death by violent crimes by 151% in some of the major cities. So if we had done nothing at all about this and treated this like a regular cold and flu season, less people would have died than would have died from coronavirus. Typical cold and flu season gets worse, peaks, and that's where a lot of people are sick, some people die, and then herd immunity develops, and then the virus eventually extinguishes itself. But because of what we've done, we've just taken that curve and we've kind of extended it out. So the same amount of people are going to die from coronavirus, the same amount of people are going to sick. It's just going to take us longer to get over this. So, look, Mother Government cannot win the battle against Mother Nature. If we had done nothing at all, less people would have died from COVID-19. So, what do we do now? We need to go back to what normal used to be. We need to reopen our businesses. We need to send our kids back to school. Look, it's causing them much more harm staying at home and not going to school. They might go to school and get sick with a cold. Okay, that happens all the time. But look, let's take our chances here. We have a 99.9% chance of getting coronavirus and doing fine with it, or we have a 100% chance of losing our businesses and causing harm to our children by continuing our current actions. So the amount of devastation that has occurred from our actions is enormous. We need to stop this and go back to what normal is. We need to stop routine testing for coronavirus. We have never done this for any upper respiratory virus before. If you're sick, yes, if you go to the hospital, yeah, we test you for influenza and certain viruses just so we know what's happening. But this routine testing, these mandated testings by employers, mandated testings at our surgical centers before surgeries, we've never done that before. We're wasting millions of dollars and people's time and delaying healthcare further. So I'm appealing to all the healthcare providers out there. You know how to practice medicine. You know what's right and wrong. And look, we're being told, not to use hydroxychloroquine. Okay, yes, use hydroxychloroquine. Don't use the Z-Pak antibiotic because it doesn't fight. Well, we know that antibiotics don't do anything for viruses. But we also know that there are a lot of people out there who have lung disease, asthma, and if they get a viral upper respiratory infection, they could die because of a secondary bacterial pneumonia or bronchitis that they develop from it. So is it bad medicine to give somebody a Z-Pak antibiotic and prednisone, a steroid, to help keep them from getting worse and developing a secondary bacterial infection? I think that is what we've done in the past as healthcare providers, and we should continue practicing medicine the way we know we should. So here we are in a mess. Our country's falling apart. What do we do now? The silent majority, the majority of the patriots out there, ex-military, the people who love this country, who have fought for this country, we need to stop being silent. We need to stand up and say, enough's enough. I'm going to propose that the people of America, that we adopt a declaration of expectations, not a declaration of independence, a declaration of expectations. What we, the citizens of the U.S., expect from our governing officials, the officials that we elected for the people, by the people. We expect them to act in a certain way for the people. And I don't see that happening. My gosh, we tell our kids when we send them off to school and everything, you need to learn to work together. You might have some differences of opinions and stuff, but you still need to try to work together for the best interest of everybody. I don't even see that happening in our own government. Our government is so bipartisan and divided, it can't even achieve the smallest of decisions these days. So what should be in this Declaration of Expectations? Well, first of all, we need to plainly say what we, the citizens, are going to tolerate and what we will not tolerate in the future. We will not tolerate the government stepping in and telling us to shut our businesses down and destroy our livelihoods. We will not tolerate them telling us not to go to church and to worship. We will not tolerate them telling us that we have to have mandatory vaccines. Look, a lot of us don't trust the government, and we have reasons not to. We don't know what your plan is with these vaccines. So we've never had to have a vaccine for a cold virus before, and it's kind of suspicious that you're trying to force this and mass produce this at this time. So people of America, please post back to me. Tell me what you think should go in the Declaration of Expectations. And I think we should get some lawyers involved and then have it go up to the House of Representatives, the Senate, Congress, and have them vote on this and maybe ratify it into the Constitution or Bill of Rights, saying what we, the citizens, expect of our governing officials. So to wrap things up, I would just like to say that all of us should try to work together and really please stop this panic. There is no reason for this. What we have done is, and at first I agreed with shutting down until we knew what we were dealing with, shutting down, rebooting, quarantining, social distancing, everything. I agreed in the months of March and April when this was really hitting hard and we didn't know what we were dealing with. But now we do. We know that this is an upper respiratory virus that is probably less virulent than most of the influenzas that we have dealt with. Its death rate is about the same. So we have about a 99%, if you're a generally healthy person, you got about a 99% chance, 99.9% chance of having a bad cold and getting over it. Those who are sick and elderly, do I think you should wear masks? Absolutely. I think people who work in nursing homes, nursing care facilities, and hospitals, I think they should wear masks because they are dealing with sick and elderly patients all the time. But for the rest of the population, it is unnecessary. It is a violation of our civil rights and our constitutional rights. So I'd just like to ask all of you, go outside, take a deep breath, enjoy the sun, go say hi to your neighbor. Yes, maintain social distancing, hand washing. During any cold and flu season, we should all act a little bit more responsible. If you are sick, you should stay home. You shouldn't go to work and to church and to go shopping. If you do, you should wear a mask. Otherwise, this madness has to stop. I appreciate your time. I hope you'll come back to see me again on Malin Medical Magniloquence, Episode 4, The Creation of Narcotic Nazis. Well, before I go, I'd like to say a shout out to some of the other YouTube subscribers and people who I've also been following, my wife and I. Beverly and Betty, God bless you. Keep fighting the fight. You guys are fighting the fight for America on a different front, and I'm supporting you. Candace Owens, eloquent speaker. Keep it up. Terrence K. Williams, man, you cracked me up with your video. Just killed me. Peggy Hubbard, your stance, I'm supporting you wholeheartedly. David Harris Jr., good conservative guy, we love you. And we are supporting you, and we are supporting President Trump. If this country does not see President Trump in the year 2020, we are in big trouble. And I think you all know that too. Thank you for your time.